What inspired me to pursue a career in medicine was actually during my role as a registered nurse and working with residents and physicians, and kind of just seeing how they, work their way into diagnoses and treatment. And I feel like my ongoing passion for learning, even at that time, I wanted to kind of take a step further and get into medicine, even though I loved my role as a nurse, but I felt that I was always more interested in the diagnosis and treatment and the reason for those things. My approach to patient care kind of involves meeting the patient and the parents, because we're going to be, seeing a lot of parents as well, especially in pediatrics, is meeting them kind of halfway in terms of decision making, because obviously I have background in medicine and I have all this scientific, data and things that I could support in terms of my decisions. But if it's not going to practically work for the family or the patient, then it's kind of pointless. So I want to make sure that when I'm doing my treatment and my care, I want to make sure whatever I am saying, and maybe providing multiple options to see what actually works for you. What I find most rewarding about my work is, being able to help patients, especially in our GI world. We see a lot of patients that come with pain or discomfort. And as we know, our gut, if there's any issues, you can't function. And, thinking about patients that deal with gut issues from day in and out, and that affects their life. So it's rewarding when you're able to make progress, whether it's by diagnosis and treatment or just with conversation. And then also just meeting new people. I think it's, really great that you get to see different patients. And yes, that it's in a setting where you're trying to help them. But I think if you're able to help them and they feel better and they have confidence in you, I think that's amazing at the end of the day.